Population aging is a human success story, the result of improved public health and medical advances, as well as overall socioeconomic development. The transformation from a mostly youthful population to one with a growing share of older persons has been particularly rapid in Asia and the Pacific. The sheer number of older persons in the region has made this topic a global and regional megatrend, affecting all aspects of society in Asia and the Pacific and beyond. Improving the quality of life of older persons and giving them a voice will help build inclusive and sustainable societies for all ages. With this goal in mind, members and associate members of the Economic and Social Commission for Asia and the Pacific, ESCAP, met and adopted an outcome document in July 2022 in which they committed to accelerate the implementation of the 2002 Madrid International Plan of Action on Aging. They also recognize the synergies between the Madrid Plan of Action and the United Nations Decade of Healthy Aging, recommended partnerships for policymaking, and highlighted several priority areas for action. As the Second World Assembly on Aging approaches its 20th anniversary, they committed to intensify efforts to promote and protect the rights of older persons, and to strengthen their participation and opportunities in economic, social, and political life through a set of forward-looking recommendations. These recommendations and additional information are included in the ESCAP Asia-Pacific Report on Population Aging 2022. Older people's associations and civil society organizations promote and represent the voices of older persons, and they are important development partners. They support policy implementation at the community level and build capacities on issues related to aging. Mainstreaming aging into national development strategies and prioritizing the perspectives of older women and older persons with disabilities is essential for inclusion and sustainability. Eradicating poverty in old age, especially for older women and older persons with disabilities, is dependent on supporting older persons' right to work for as long as they want, with stable income security and pension schemes. When they have access to full and productive employment and decent work under healthy and fair conditions, and they are free from abuse, neglect, and discrimination, they can continue to contribute as active members of society. Climate action and emergency plans for times of disasters and conflict resolution could benefit from older persons' experiences, perspectives, and participation. The COVID-19 pandemic has affected older persons disproportionately. At the same time, many older persons, in particular older women, have been the backbone of societies, and they have provided food, shelter, and care for extended families. Many lessons have been learned that could be used when facing future pandemics and emergencies, including those related to overcoming neglect, isolation, and loneliness among older persons. Universal health coverage and access to quality and affordable physical and mental health care, as well as long-term care, are key to ensuring active and healthy aging. The people who provide care, whether they be public, private, communal, formal, or informal caregivers, need the support to offer high-quality, integrated, and long-term care. Older persons, especially older women and persons with disabilities, have the right to adequate housing and community services that meet their rights and needs. With more older persons in the workforce, it is important to more effectively promote literacy, numeracy, and technological skills, as well as retraining and reskilling. With the right support, women, who often take on the role of long-term caregivers of older persons, can maintain their livelihoods and continue to thrive into old age. We must combat neglect, abuse, and ill treatment of older persons and violence against them, in particular older women. This work includes stopping all forms of ageism and supporting a positive public image of older persons and their invaluable contributions to societies. Disaggregated data help us understand the situation of older persons. But we also need stories. We want older persons' voices, perspectives, and experiences. Undertaking research and enhancing the capacity to effectively collect and analyze data, statistics, and qualitative information will make the invisible older person visible. And of course, any sustainable plan includes regular follow-up. By assessing the situation of older persons on a regular basis and inviting them to participate in the policy-making process, we ensure the promise of building a society for all ages is kept. As the first regional review and appraisal of the Madrid Plan of Action held during the United Nations Decade of Action for Achieving the Sustainable Development Goals, member states and civil society organizations in Asia and Pacific agreed that it is important to take action now. Let us join forces and build sustainable societies for all ages.
The Asia-Pacific region is undergoing profound and rapid population changes, and all countries in Asia and the Pacific are in the process of aging at an unprecedented pace, although the timing and pace of the transition varies across the region.
The elderly and the development is like cross-sectoral issues, where not only social issues, but also other sectors such as like transportation, infrastructure, education, health, empowerment, and also entrepreneurship. We have quite older people in the legislative because they be in the very strong positions in the political parties. So I guess they can be more towards the elderly, so they can have strengthen the policy towards the elderly itself.
For something like aging, so broad, really requires a whole society response. Whether it's at a systems level with government, we look to the government like to create a kind of social pension system, healthcare system, but we have to filter all the way down to individuals. Individuals have to learn to take care of themselves, stay healthy, be productive and all that. The family has to step up to create a supportive environment to prevent social isolation and all. Communities step in when the family cannot be playing a role. And private sector often gets off the hook. Where are they? So it really requires a concerted effort across all those who work. So different countries have their own solutions, but generally speaking, I think the biggest challenge is that all those pieces come into place and have them be integrated. So that's one of the biggest challenges.
Civil society is an extremely important group for the reason that civil society is at the ground level. It is directly connected with the local communities. Civil society is very knowledgeable of local context and local conditions. There are multiple things that civil societies can do. The first thing is that civil society organizations can connect the dots between older people, people in remote areas, and policy directions. They can bring in the voices which are unheard. They can bring in the ideas and feedbacks which work well at the ground level.
I think the states and governments have to create the conditions for older people to continue working, for example. Some of the retirement laws or compulsory retirement, like in some countries in the region, were designed when longevity was much shorter, when people were living 10 years or 15 years after reaching the retirement age. But now lifespans have extended and people reach old age in better health, better educated, more committed, more interested in being part of a society. No?
The government has to educate the younger persons to respect the older persons, and schools and institutions should be taught that one day you will be in their state. So now go out and spend quality time with your grandparents, and from them you can learn your cultural background, your heritage.
We need to do research on what's happening. There is huge opportunity for good longitudinal research that could be done within countries, comparative research across countries, and agencies like WHO, ESCAP. We could do a lot more on really finding out what is the situation for older people in countries. But we need stories, we need qualitative data, we need to understand, and this is what I meant by longitudinal studies.